I'm Dr. Syed Raza. I'm Vice President of Medical Operations at CHI St. Luke's Health in the Woodlands, and I practice internal medicine. There have been new standards for blood pressure management that have come out in the last 12 months. And what they're stating is basically if your blood pressure is 140/90 on a consistent basis, and that means that it's not white coat syndrome, you're not freaked out by going to see the doctor, you're at rest, you're relaxed, you're not in pain, and your blood pressure remains 140/90, that means that you probably need to be treated. Between 130 systolic and 80 systolic to 90 systolic, it's what we call level 1 hypertension. If that remains at that level and you have any risk factor or you've had any kind of cardiovascular event, then that should be treated as well. Between 120 to 130 and 80 to 90, if you haven't had any sort of cardiovascular event, then that should just be monitored. Obviously, the goal of having a blood pressure of 120 systolic and 80 diastolic remains in place, and if you're not symptomatic, then that should continue to be monitored without any adjustment in medications.